Jacking up taxes on cigarettes could dramatically cut smoking rates. That's the provocative finding in a new article published in the New England Journal of Medicine today. It was co-authored by Canadian tobacco control expert Prabhat Jha from St. Michael's Hospital in Toronto. He says the best way to stop the rising rates of smoking around the world is to stop making cigarettes cheap. Let's take a look at what his proposal could mean for the cost of lighting up here in Canada. Take a look at this. For example, what the tax hike would mean in Quebec, where cigarettes are the cheapest in the country. Right now, the price of a carton is just under $77, and $17 of that is for a federal excise duty. So tripling that tax to $51 would bring the price of a carton to just under $128. That means smokers across the country could pay an extra $34 for a carton of smokes. So let's bring back in our panel. This report comes after taxes in Canada were lowered to combat the problem of smuggling contraband tobacco. So would hiking the taxes back up lead to lower smoking rates? Or would it just drive smokers to buy more cheap cigarettes from smugglers? Joining me again from Vancouver, Andrew Saxton, the Parliamentary Secretary, Minister of Finance. Hedy, she's the Liberal Health Critic. And in Edmonton, Linda Duncan is the NDP's Western Diversification Critic. Thank you all for sticking around for this. Now, Mr. Saxton, we're going to come to you again first. There was a time in this country when you could expect to hear about a new tax on cigarettes almost every time a federal budget was introduced. So will the government consider this type of suggestion?
Well, Hannah, as we all know, smoking is a drain on our healthcare system. It affects, thousands of Canadians. Thousands lose their lives every year as a result of smoking. So whatever we can do to bring down the usage of smoking, I think it's really important. Also to prevent young Canadians, teenagers who are probably most vulnerable at starting smoking, to prevent them from starting smoking. So if taxes is one way to do it, then certainly we're going to take a good look at that. The bottom line here is that smoking is bad for the health, it's bad for our healthcare system, and therefore we should look at ways of combating smoking. Now obviously contraband is another concern of ours, which is why we introduced tough new measures, anti-trafficking measures in November, in the fall of this year, to help bring down the rates of contraband tobacco, which is making tobacco, bringing it into the hands of those that shouldn't have it, young Canadians, teenage Canadians, and therefore we need to crack down on contraband tobacco as well.
Now, and to give your government credit, you also put those labels on the cigarettes, the harsh labels, but the last time anything was changed when it came to taxes was the early 2000s under Paul Martin. So you're saying the government would consider something like this? How quickly would it consider?
Well, look, we'll have to wait and see what's in the budget. But all I can say is that we take smoking very seriously. Its impacts on Canadian society is very negative, and therefore we have to take action to try and prevent new smokers from starting, and also to help existing smokers to cut down on their habits. So we will look at all ways of doing that, and of course taxes is one of those ways.
So this is something that the government is considering for the next budget?
All I can say is we're looking at all ways of bringing down the incidence of smoking and smoking-related diseases in Canada.
Now, Ms. Duncan, let me bring you in. Is it time, do you think, for a tripling of taxes on cigarettes?
Well, I don't think there's any doubt about it at all. I think it's important to point out that the report by Dr. Jha, that was a peer-reviewed report and published, is simply reiterating what the World Health Assembly and the World Health Organization have recommended. They've called on all nations around the world to raise the price on tobacco to reduce the use. And what these experts around the world have found is the greatest determinant for stopping people smoking is to raise the price. Apparently France and South Africa, among many other nations, over a 10 to 15 year time period they tripled the cost of their cigarettes, and they reduced the usage by a third.
Right.
So it's been proven that it can work. So I think, it's the federal government has not raised taxes on excise taxes on cigarettes since they came to power, and I think that it's a tool that they have, and I think that they should exercise it. I think that we should be responding to what the international organizations are telling us is effective. Obviously, we've got labels on cigarettes, a number of measures, contraband, the legislation on contraband tobacco is now before Parliament. We'll debate it after Christmas. But that's only one factor. I don't think that all people who are smoking in Canada are using contraband cigarettes. They're also going to the local store and buying them.
But Ms.
So
Fry,
I think it's something worth debating in Parliament.
Ms. Fry, I want to bring you in here. It's interesting.
Yes.
I have a tweet here from Michael Marsh, and what he's saying is that increasing the tax on tobacco only opens up contraband sales. Is that a concern?
Well, in 1996, when we raised a very high rate of taxes on cigarettes as a Liberal government, we did find that. We found that the differential between Canada and the US was so great that smuggling began to occur on border cities, border towns, etc. And it became a real problem. And so I think that it is something to think about. I mean, in theory and on paper, it is absolutely true. If you raise the cost of tobacco or the price of a cigarette, people will, in fact, it will decrease smoking habits. But there are other things you have to think about when you consider smoking cessation. I mean, this government says that they would like to do something, but in their last budget, they cut the smoking cessation program, which the hike on taxes used to go to fund. They cut it by 30%. So you can't say you want to do something and cut smoking cessation programs, which includes education, prevention, helping people to quit, finding ways for the provinces to work with the provinces to help people to have access to nicotinic gum or whatever they need to help them to quit. So I do think that it's not a simple solution. Raising taxes on paper would work, but then you get this problem of increasing contraband, which we found to happen when we did it the last time.
Mr. Saxton,
now, again, tobacco labeling, which we brought in, was a key piece. And the extreme labeling that this government just passed was stuff that Martin just brought in but didn't get to implement because he lost office. But the thing is, it was something that was really important. And that labeling has been shown also to have one of the highest impacts. But you cannot forget public education, prevention strategies are key. And it would be nice to increase the money for the smoking, the anti-smoking strategies that this government cut.
I want to bring Mr. Saxton in on that. If taxes were to go up on cigarettes, which could possibly happen in maybe the next budget, should all the revenue go directly to provincial health programs?
Well, look, obviously there needs to be also a commitment to bringing down the incidence of smoking, and it's been working. We did introduce that in the last 5 years. In fact, the percentage of Canadians smoking has reduced by a third in the last 5 years, down from 22% to 16%. And we all remember that when we were kids, it was much, much higher. I think about half of the kids that I knew in school smoked, and it was very bad. So it's gone down significantly since then. Measures that we've introduced in the last number of years are working, and the figures show that.
Mr. Saxton, Andrew Saxton, Linda Duncan, and Hedy Fry, I want to thank you all for coming in and tackling both of these health issues, and Happy New Year to all of you.
Happy New Year to you too.